Bicillin LA, penicillin G benzathine injectable suspension, is indicated in the treatment of infections due to penicillin G sensitive microorganisms that are susceptible to the low and very prolonged serum levels provided by this particular dosage form, including syphilis, yaws, basal, and pinta. Penicillin G benzathine is contraindicated in individuals with hypersensitivity to any penicillin-type antibiotic. Use with caution in individuals with histories of significant allergies and/or asthma. Give only by deep intramuscular injection. Do not inject by any other route, such as intraarterial or intravenous. Do not inject into or near nerves or blood vessels, since such injection might produce neurovascular or other damage. Warning: not for intravenous use. Do not inject intravenously or admix with other intravenous solutions. There have been reports of inadvertent intravenous administration of penicillin G benzathine, which has been associated with cardiorespiratory arrest and death. Prior to administration of this drug, carefully read the warnings, adverse reactions, and dosage and administration sections of the labeling.
I'm Dr. Charles Pamplin, Vice President of Medical Affairs at King Pharmaceuticals Incorporated. In the recent Sexually Transmitted Disease Treatment Guidelines, the Centers for Disease Control and Prevention, CDC, recommended parenteral penicillin as the preferred treatment of all stages of syphilis. As the only manufacturer of Bicillin LA penicillin G benzathine injectable suspension, King is committed to educate healthcare professionals on the continued importance of properly treating syphilis. King has just opened a new state-of-the-art Bicillin manufacturing facility in Rochester, Michigan. With syphilis infections steadily climbing, we will seek to ensure that the plant will provide continued product availability. Recent reports from the CDC still urge medical professionals not to substitute Bicillin CR for Bicillin LA long-acting in the treatment of syphilis. King urges healthcare professionals to read all labels carefully because Bicillin CR is not indicated for the treatment of syphilis.
Syphilis outbreaks continue to be reported in major U.S. cities. In most forms of syphilis, one single dose of Bicillin LA, 2.4 million units, via deep intramuscular injection is the recommended treatment for adults in the absence of specific contraindications. The blue Bicillin LA package contains the new syringe delivery system, which makes it easier to assemble and apply the needle. At our clinic, we prepare the medication before the patient comes into the examination room. We remove the medicine from the refrigerator and allow it to warm to room temperature. We also gently shake the contents of the syringe and warm it up by rolling the syringe back and forth in our hands. In our experience, some patients might be nervous about receiving an injection. That is why we carefully explain what to expect in terms of pain, discomfort, and possible side effects, including mild fever, headache, and fatigue in the first 24 hours after injection associated with the Jarisch-Herxheimer reaction. To make the patient more comfortable, we recommend that he or she lay face down on the treatment table and point his or her toes inward, which relaxes the muscle at the area of injection. We also tell him or her that he or she will receive 2 injections of Bicillin LA totaling 2.4 million units, the recommended dose. This is divided into 2 injections, 1 in each buttock. In adults, we give it by deep intramuscular injection in the upper outer quadrant of the buttock. We stretch the skin downward at the injection site, which makes it easier for the needle to enter the skin just before injection. We ask the patient to take a deep breath, and as he or she exhales, we insert the needle into the muscle. At this point, we draw back to make sure we have not entered a blood vessel. We give the injection over 20 to 30 seconds. After the injection, we release the skin, creating a valve effect, preventing the medication from leaking outward. Additionally, we apply pressure and massage the injection site for up to 1 minute. Finally, we ask the patient to wait for 20 minutes to make sure they do not have any immediate serious side effects. Remember, Bicillin LA is not for intravenous use, nor should it be mixed with other intravenous solutions. Do not inject into or near an artery or nerve. In neonates, infants, and small children, the midlateral aspect of the thigh may be preferable. If you have any questions about treatment and dosing, please refer to the Bicillin LA product information sheet or visit www.bicillin.net.
We hope that you find this video helpful in the proper use of Bicillin LA. If you have any questions, please contact King's Professional Information Services at 1-800-776-3637.
Warning: not for intravenous use. Do not inject intravenously or admix with other intravenous solutions. There have been reports of inadvertent intravenous administration of penicillin G benzathine, which has been associated with cardiorespiratory arrest and death. Prior to administration of this drug, carefully read the warnings, adverse reactions, and dosage and administration sections of the labeling.